Hello everyone, my name is Angela Leonard. I currently take sterile processing or surgical instrumentation part 1. A little bit about me. I am a sterile processing tech 2. I have been for about a year and a half at Aurora. Altogether my career is 4 years. So I just wanted to give a little bit of that background about myself. I'm very familiar with trays as big as major vascular, minor vasculars, laminectomies. I've done aneurysm clips, trays. I've done a lot of synthes. So I have a pretty broad knowledge of surgical instruments. But today I would like to go through and unpack my instrument box with you and kind of show you what piqued my interest. So here we go. I'm gonna just flip this down. Okay, hopefully you can see. Okay. So, got this box full of instruments from my bag. And inside of it came a sheet with all the instruments on here that are listed. Now, I decided to take them all out and play the guessing game of what's what. And I actually knew quite a few. Some of them I was leery about, and I got the names wrong, but that's okay. So in doing so, I ended up finding a couple of instruments that piqued my interest, which was the S retractor. I'm going to take it out the package so you guys can get a better visual. The S retractors. So the S retractors, I really like these instruments. I've seen them in lap tissues and I think general minors at work. They are awesome because they hold the wound open. So much, I'll put an example like this. They hold these wounds open and apart so that way the surgeon can get a better look at the underlying organs. So these are going to be used in like general cases. Like I said, I've seen them in lap tissues and I think gen minors, either gen minors or gen majors, one of the two. So, but those kind of piqued my interest. Put that over here. And then we have the Meyer-Ding retractor, which is a manual retractor. We have some retractors are self-retaining, which means they have the teeth in the middle that kind of, you put it in place and it holds itself open. But this one is a manual. So this one too, the Meyer-Ding, it hold back tissue. So one thing this is special in procedures, neurosurgical or spinal cases, they use this in a lot. So I really like this because the rake, you see, it has the teeth. Those little teeth are sharp. I have seen Meyer-Ding retractors, ortho retractor set, which is used in ortho cases, but sometimes they are used in neurosurgical procedures, and they also hold back small tissues and also muscle. So this retractor is pretty cool. So the next thing that I opened that I found really cool is, and it's underrated, it's kind of like the underdog of instruments, is the bayonet forceps. Now, I've also seen electrical bayonet forceps, which are really cool. They usually have like electrical current at the top, and you use them just like this. But the bayonet forceps also are, they hold apart tissue. They lift the tissue. They're very delicate. And this one doesn't have teeth, it has serrations. But they're very delicate instruments, so they lift very slowly, very small parts of tissue that you can't grip. They lift that. These are used in craniotomies, which are, again, up here in the brain. So they move those small, delicate tissues around so that you can be able to get a better visual as well. They also can be used, and I didn't know this. I actually found a fact about it, and I'm reading it actually. So I wrote it down because I didn't know. But they're also used to remove sterile wound dressings. So I think, and I'm gonna assume and go off of that and say, I think when you go into to get your stitches and stuff removed, or If you're getting something that needs to be picked out that's been covered, I believe this is something that is utilized for that. This, I just like the funky shape because it looks like an old school bayonet, which is a gun. From the 1800s is what I learned in history. Like a lot of the guns in history, they look like this, which is why I think they call it a bayonet, Jacobson bayonet forceps. So that's my little clip about the instruments. Now there's many more. I also picked out the needle holder, which I discussed this week in my discussion. So maybe I should go over it. All instruments need to be pulled apart upon sterilization or cleaning to get in between those ratchets, those handles. You see that? That clicks and closes together. And then right here, you see that? It's easy for tissue to get caught right in there, and even with those serrations. The needle holder is another underdog because it's used at the end of surgical procedures. It's used to help assist with stitching. So, and I actually watched something about how to stitch a wound closed, like the technique that they use, which I found to be very interesting and very awesome. But the needle holder is another underdog. It's one of those instruments that people, they don't think they really need it, but they do. So these are used in pretty much all surgeries. Any surgery to deal with closing up a wound. So that's pretty much every pan has several different types. They have the cryo wood, they have your male Hagar, they have extra long ones. I can't think of some of the names, but the Vital needle holder was another one that I worked with quite a bit at a larger facility. So, but to end this segment, I just wanted to go ahead and discuss with you the instruments that I found in this box. There's so many more, so many things I thought were cool. So we got the Diva retractor, which is another underrated one. This one is something I never seen. It's called a Coker Ochsner forceps. Excuse me if I'm saying that wrong, but this one is really, really cool. And then we have my favorite male scissors because they can be used in just about anything. We have the suction. This is the Fraser suction. It's 10 French. Now, they give it the name based off of what it's measured from here to there. It also comes with a small stylet inside. You can't really see. I don't want to open up everything, but that's to pretty much unclog the instrument. When we get this down and decontam, what we do is we take a brush and we make sure we brush through. We hold it under the water and we flush it until we see all that tissue come out. And then some of us, myself, I love using the Sonic. We use that Sonic to kind of make sure it's passing through. Because remember, if you don't flush or brush your instruments, when it gets on the clean side, there typically is a lot of bioburden, debris, things that are caked up inside of there. So it's very important with suction, you flush and brush and make sure you throw it through the Sonic if you're feeling like it. And you can even take it out the Sonic and flush and brush it again just to make sure you're getting everything out before you put it in the washer. All right, guys. Well, thank you very much for watching. I appreciate it, and I'll have a part 2 in just a second.